Now, the one thing that I already heard you say, which I'm going to say we need to never say, is migraine with an S on the end, the word migraines. This is what everyone says. I have migraines. I'm having migraines. I got a migraine again. When you have migraine, you as a human being live with migraine disorder, period. Hello, my name is Madison.
My name is Rachel, and welcome to the Well-Being Podcast. You guys,
Yay.
today we are joined by a super amazing, prestigious, beautiful, lovely guest, and her name is Dr. Madison,
It's me,
and
guys.
also my co-host. So I'm really excited about this one.
You're so
I
funny.
I thought about this intro last night, like while I was falling asleep. I was like, I'm gonna
I love you.
nail this today. So I told Maddie a few weeks ago we were trying to think of like new topics and stuff to talk
Mhm.
about, and I was like, I need to interview you. I need to pick your brain. I need to know all the things there is about migraines and all the things about that. So I'm a newbie on this topic. I've asked you a few like smattering of questions, I feel
Mhm.
like in the past, but I also have no idea about anything to do with this. Um, my history, a little bit, I've had a
Mhm.
few migraines in my life, and they've been debilitating. Like I've maybe had like three, and I remember each of them just being so terrible. But yeah, we can get into that a little bit, and I might ask some more specific questions. But to start off, can you tell us a little bit about what a migraine is?
Mhm.
And just like your history, how you know this much about such an obscure subject.
It is very obscure, but most of the population, I should not say most, a huge percentage of the population in the world has migraine. So anywhere from 12 to 15% of the global population has migraine. That is roughly 1 in 7 people worldwide. So if you put all of your besties in a room, at depending on how many friends you have, which for me this is like 7 to 10 people, at least one of them is going to have migraine. Um if you have just women in a room, that is going to be an even higher prevalence. 20%, 20, depending on the study you read, up to maybe even 40% of women have it, compared to about 10% of men. So migraine is a very, very, very common disorder, way more common than the things we think about as like, oh my gosh, everyone has these. Like, not everyone, but many people have these, like diabetes or asthma or epilepsy. Way more people have migraine, and it is the least funded disorder for how prevalent it is because it is so heavily stigmatized. Now, the one thing that I already heard you say, which I'm going to say we need to never say, is migraine with an S on the end, the word migraines. This is what everyone says. I have migraines. I'm having migraines. I got a migraine again. When you have migraine, you as a human being live with migraine disorder, period. Migraine disorder is like I have asthma. I have epilepsy, right? You
Mhm.
wouldn't say I'm having epilepsies. I have epilepsies. I have asthmas, right? You say I'm having a seizure or I'm having an asthma attack. The exact same thing is true with migraine because similarly to epilepsy and asthma, it is not an acute event. It is a neurological disorder that lives in your brain 24/7. People love to yell at me about this. It is a genetically predisposed disease. It runs in people's families, or if for some reason you get some genetic twist in your genes, you could start having migraine. Now, do we have every single form of gene of migraine? No. But we do know it's hereditary. We do know it runs in families, and you are way more likely to get it if you have a family history of migraine. Now, I know about you that you do have a family history of migraine, and that is pretty common. Some people will say, I have no family history of migraine. No one in my family has ever had a migraine. And then we break it down and they're like, well, my grandma had sick headaches where she laid in bed for days, or my grandma had this, or my mom had that. My mom was always popping Tylenol for her headaches. Usually it's migraine. So we say, I'm having a migraine attack. I've had many migraine attacks in my life, but we don't say migraines because that adds to the stigma that it is just a headache
Mm.
or it is a acute disorder when in reality it is a full body chronic disorder, and sometimes you have the acute representation of that disorder. Does that make sense?
Yes. And I fully apologize,
Do not
everybody
apologize.
in the
Literally, no
world.
one knows this.
That's so interesting
Literally,
though,
no
and
one
that
knows.
makes so much sense too, because a headache is like a headache. Like everybody gets, which I actually want your, I'm not even gonna speak on this. I'm gonna ask questions first. What am I saying? Um, but that makes more sense to recognize it as that and describe an individual event as a migraine attack, similar to like an asthma attack. That makes a lot of sense. You crushed that completely.
Thanks. That's my
Um,
job.
okay, can you tell us how migraine and symptoms of that, what an attack might look like, and how that differs from a headache?
Yes. So, headache, you can have cluster headaches, you can have tension headaches, you can have a million different types of headaches. It doesn't necessarily make it fit the diagnostic criteria of migraine. There are very specific diagnostic criteria of migraine, and not every migraine is going to look the same. So, the reason that I got into this, that I guess you asked me this before and I didn't answer your question of how do I know so much about this information, is that if you guys do not know me from my real full-time job, I am a vestibular physical therapist, and I only treat pretty much within reason, like 98% of the time, vestibular migraine, which is a type of migraine that doesn't even require head pain, which is why I am so passionate about the fact that migraine is not a headache. So if you look at the migraine diagnostic um, criteria, there are many, because migraine is a spectrum disorder. I know we talk about spectrum disorders with things probably in your world like autism, right? But migraine is also a spectrum disorder because it sits on a spectrum of frequency, intensity, and symptoms. So there's a frequency spectrum. Some people have attacks every single day, some people get them 3 times in their life. The intensity, some people get them, they last a day. Some people, a singular attack lasts more than 72 hours. And there's
Oh,
phases of these attacks and things like that. Now, the actual diagnostic criteria for migraine without aura is at least 5 attacks fulfilling the following criteria: attacks lasting 4 to 72 hours, untreated or successfully treated; headaches with at least 2 of the following characteristics. So, unilateral location, pulsating quality, moderate to severe pain intensity, aggravation by or causing avoidance of routine physical activity. So, walking, doing the dishes,
mm,
climbing up the stairs. And then headache during at least one of the with at least one of the following: nausea and or vomiting, photophobia and or phonophobia, which is light sensitivity and or sound sensitivity. And then, of course, not better accounted for by another ICHD3 diagnosis, which is International Classifications of Headache Disorders. Now, you can have aura within that. You can have lots of different things within that. That's the basic migraine without aura diagnostic criteria. Now, this gets really convoluted very, very quickly because
can I
you can
ask a
have,
very quick
yes,
question? Can you
yes,
define aura?
yeah. Um, so an aura is a temporary set of neurological symptoms that precede or accompany a migraine headache. In this case, you can also have
Oh,
migraine, or you can also have aura with other disorders.
hmm.
But this makes a little bit more sense if we kind of go to the phases of migraine. So, a phase of a migraine attack, there are 5.
Mm,
Interictal means between attacks. So, you right now, you're not having a migraine attack. You maybe had an attack, let's say 6 months ago, and you have not had one since. So, you are in this phase called interictal. This means between attacks, and you could have still more light sensitivity, more sound sensitivity, more smell sensitivity than the average common person.
mm.
Because a person with a quote migraine brain, which is not everyone's favorite terminology, but we're going to use it for now, is that you have a hypersensitive brain compared to the average bell curve. Now, when you start to get an attack, you will go into the first phase, which is prodrome. 2/3 of people with migraine disease have prodrome as phase 1. This is anything from increased irritability to increased urinary frequency to craving of food. So a lot of people will
Mm.
say like chocolate causes my migraine attacks. Wrong. Chocolate could maybe be a trigger. Food triggers are we can do that in part 2 of this because we will do a part 2.
Ooh.
Um, food triggers are a situation and a half in this world, but usually it's a food craving. So I craved chocolate, I had chocolate, and then I got an attack. You were already in prodrome land where
Mm.
you're having food cravings.
Okay.
So then phase 2 is aura. Only about 1/3 of people with migraine have aura. So this is going to be visual disturbances. So some people will see flashing spots, blind spots, wavy lines, zigzags, shimmery things, etc. You could have sensory changes, so numbness, tingling, pins and needles, sensation on your face, arms, legs, or body. You could have motor disturbances. So this could be you could get weak or paralyzed and appear as though you're having a stroke on one side of your body, despite the fact that you're actually having a hemiplegic aura, which is fascinating.
What? That
Mm-hmm.
is so
It
wild.
is so wild. So everyone's like, oh my God, I'm having a stroke again. But it's actually hemiplegic migraine. Speech difficulties, so slurred speech, trouble finding words, difficulty understanding language, and then cognitive changes. So you could even have confusion, difficulty concentrating, feeling unfocused, which usually is more prodrome-y, but aura is vast, and most people are like, if you're not seeing or smelling something, it's not aura. Wrong. Like you can have a million types of aura, but most commonly it's you see this like shimmery or zigzaggy thing in your brain or in your line of vision, or some people will
Okay.
go fully blind for
Wow.
45 to 60 minutes at the maximum. If you have it for more than 60 minutes, you have extended aura, and that's something that your doctor absolutely needs to know because there are different things that you can and cannot take just generally in your life, like birth control,
Mm.
because of that.
Wow.
Um, and when you're done with that, you will usually go into, quote, the headache phase. I hate calling it the headache phase because 40% of my patients have never experienced headaches with their migraine. Migraine, I guess so the phase 3 that I like to call it is the impact or the attack phase. This is when your symptoms are most heightened. So this is when people get a really awful headache, they get dizziness and vertigo, they get other symptoms that are the most intense at that time, lasting anywhere from a couple of minutes to up to 72 hours. If your attack phase lasts more than 72 hours, that is what we call status migrainosus, and that is a conversation for another time. But if symptoms are lasting longer than 72 hours in the attack phase, you need to call your neurologist. And then last but not least is the post-drome. A very small percent of people say that they feel like a new person. They feel fantastic. I feel so good at the end. Most people feel like they're hungover.
Mm.
And that can last similarly to prodrome, anywhere from 24 to 48 hours. So
Okay.
all together, if you're like 48-hour prodrome, 48-hour postdrome, and 72-hour attack phase, that can last a week.
Oh, that's miserable.
So it is a very debilitating and highly stigmatized disorder that is really, really very common, and most people don't take seriously. They're like, oh, you have a headache at work. Why are you going home? That's so silly. But in reality, you can get literal room spinning vertigo for minutes to hours or even seconds at a time, and a horrible debilitating headache, severe light sensitivity where you literally like the light hurts. How are you supposed to be in a place with crappy fluorescent lighting or even be out of a dark room is
Right.
beyond me. So there are lots of things you can do about migraine, but that is kind of like the basis of migraine as a disorder.
Wow, that was fascinating. Um, okay, so tell me if I'm getting this correctly. You can have a migraine attack that has one of the phases of it could include a headache, but you can also just have a headache that isn't considered migraine.
Correct.
Okay.
And you and your neurologist need to talk about that. And not every neurologist knows about migraine and headache. Like they know it exists, but the person to actually treat headache and migraine, no matter what type of migraine it is a headache specialist, which is kind of a misnomer because not everyone gets headache, but that's not a problem for today.
Mm.
Um, but a headache specialist is a specific type of neurologist, sort of like you are a pediatric physical therapist. Like if you have pediatric problems, please don't come to me. I don't know what I'm talking about. Like it'd be like going to a cardiologist for a headache problem.
Okay.
So you need to go to a headache specialist, which is a type of neurologist, and there are not very many of them.
And they treat headaches in general plus migraine.
So they treat migraine and headaches and facial pain.
Okay.
It's like a
Interesting.
specific fellowship. Yeah.
Okay. Okay.
Now
I'm
you
like
know.
digesting. You guys, same
It's a
thing with me.
lot of information.
Obviously, if you are somebody that has vestibular issues or migraine, don't come to me because I don't know anything. But this is super fascinating because I know some people close to me that do have it, and I wish I could help more, and I don't know what I'm talking about. So this is super, super interesting. Okay, here's a question that may or may not be dumb.
It's not dumb. Migraine is confusing and literally no one talks about it. It's not a dumb question. Like
Okay,
people have been dealing with this for 40 years and they're like, I didn't know that. Like
wild.
literally. And it's not their fault. Like literally it is not taught in med school. Period.
This is like, first of all, right now I have this list of questions, so I'm just deleting the S from migraines on all of them so I don't actually say that.
It's okay.
Second
We're
of
all
all,
learning.
second of all, you guys, Maddie is so cool. Like, are you joking? She has discovered all these things and become like this connector of a wealth of information, how to get better. It's just,
Well,
I just
thank you.
want to do a quick shout out because that's just amazing and like, honestly, like changing the world.
Thank you. I
Yeah.
appreciate that.
Yeah.
I
It was
appreciate
so
that. I love
cool.
treating migraine. It's a lot of fun. There's so many
It's
things you can do. It gets so much better.
everyone to each their own. Like everyone has their own niche, and I'm very happy you found yours and because everybody needs you.
Thanks. Everyone needs
Um,
you.
okay, my next question is this. You touched on this one a little bit. You said, I know you mentioned a room full of women. My question is basically who is most susceptible to migraine? I know I've heard you talk a little bit about like postmenopause, women in general, and then just like sometimes I know this happened to somebody that I know, um, giving like post having a baby and hormones and things like that change up like your natural state. And then that is kind of when migraine attacks become more prevalent.
Correct. So I, again, treat vestibular migraine, which is a very specific subset of migraine. It is the most common neurological cause of dizziness and vertigo. And so I can mostly speak to that, but I would be willing to go out on a limb and say that this is probably, if not definitely true for pretty much everyone with migraine. So the times that I see migraine become most prevalent are three times in your life because prior to puberty, women and or girls and boys, I should say, have the same prevalence of migraine. And little kids can get
Mm.
migraine. It usually presents as abdominal migraine, which is another type of migraine that you don't need headache for. So when people come at me, they're like, "You always need headache for migraine." I'm like, "What about abdominal?" Because that's more widely accepted that
Which is just
vestibular
like
is.
stomach pain
Yeah,
is
stomach
like
pain in
the
kids
primary.
who they like
Dang.
can't figure out what's wrong. So like you have like
Oh,
a 7-year-old who's like stomach is killing. This happened to my very best friend. Stomach is killing them. Mom has migraine. No one can figure out why. Everyone's like, she has IBS. She has leaky gut. She has this. She like all the things when she was like all through elementary and middle school. Turns out she's been having migraine literally since she was a baby. And that even they say in some cases, obviously, colic is like no one knows why, but even babies with colic, they say, are having a baby form of migraine, and that's why they are so fussy. So there are 1.5 million reasons why, but prior to puberty, I'm trying to find the statistic, but I cannot, so I will try and find it for part two. But prior to puberty, people, girls and boys, have the same prevalence of migraine, and then after puberty, when estrogen and all of these different hormones start to fluctuate in a woman's body, that is when migraine tends to start for people. Um, Again, this will happen during your first trimester of pregnancy. So when you're like, obviously you are of childbearing age when your period starts, but most people don't have kids right when their period starts. They usually wait 10 or
mm,
15 years.
yeah.
And so during that time, people are like, "Oh, just like the week before my period, or right when this happens, or whatever." It's kind of cyclical for a lot of people. They'll have attacks outside of that, but know they're going to have an attack next to their period. But then during the first trimester, when your hormones are going crazy, you're already feeling really crappy. Um, that is another time where you will get a lot of migraine attacks. And then postpartum, because that is, someone once said this to me, and I don't know if this is actually true, but it's basically like taking 100 birth control pills and then stopping them the next day. Like that is the equivalent of what's happening when you give birth. Like your migraine just will kind of explode in a way postpartum. So you need to tell your neurologist and your OBGYN, hey, I'm pregnant. This is what's happening with me. And I need a plan like postpartum, because that's also when I see a lot of people transition from classic migraine that was like sort of manageable. They had medications for, they could deal with the pain, they could work through it during the day, whatever, turn into vestibular migraine, and it becomes much more debilitating. Not that pain is not debilitating. It's just what people tell me about dizziness versus head pain.
Mm-hmm.
So hormones do matter, period. And then the last time is during perimenopause. So that zone of
Okay.
chaos, which perimenopause is literally so chaotic. And I feel like I've learned a lot about it because of my job. And it is truly, people call it, if you haven't read this book yet, read the book, The New Menopause by Mary Claire Haver. It is world changing if you are a woman over the age of 25. I think everyone should read it just so you know what's coming down the pipeline. Um, but basically, people tend to get cyclical migraine attacks near their period. Now, you have to think about migraine sort of like a bucket. And the smaller your bucket is, the more likely you will be to get an attack. And the bigger your bucket is, so your bucket, Rachel, is probably really huge. And my guess is that if it lines up that you are super stressed out, you are about to get your period, you haven't been exercising or eating well for a couple weeks because life happens, the weather changes, and then you don't drink enough water that day, that is when I can promise you'll get an attack, because that is so many things that are out of line for your normal life that your body is like, I can't take it anymore. And then you'll have a migraine attack.
Okay.
Whereas normally for you, as we talk about on this podcast, sure, there is stress in your life, but you are eating well, you are exercising, you are doing what you can, you're taking care of your dogs, you have a relationship with your husband, you're going on walks, you're seeing friends. Like when you can do all of these things together, and this is not true for everyone, some people genetically just have a lower threshold than you. Um, your hormones are in line, like whatever, that is when people don't get as many attacks. So this is a bucket.
Okay.
You have to think about it as like a water bottle versus like a pool. Like how
Yeah.
much water is it going to take to fill that up? How many triggers is it going to take to fill that up? So it's never just chocolate. It's never
Mm-hmm.
just I went for this walk and the sun was too bright. It's never just one thing. A lot
Mm-hmm.
of people spend their life trying to like pinpoint it on this one
Yeah.
thing. It's not. So hormones, leading me back to that. If you are a woman and you do not know what your hormones look like on a week to week basis, it's something that I recommend at least Googling so you know what it looks like, because we are not taught this in school, especially since most schools don't have sex ed these days. Um, but estrogen and progesterone are the two hormones that fluctuate the most throughout the month. And the both of them drop together really far, really fast from like day 22 to day 28. So that week before your period, bottoming out on day 28, staying pretty bottomed out until day 6 or 7 of your period when it climbs back up again. So there it is usually the change in estrogen and or progesterone, usually estrogen, but there's a lot of other things we could talk about there. But that change in hormones is usually the problem. It's
Hmm.
not low estrogen or low progesterone. For most people, that can be problematic if you're in perimenopause or menopause. It's like a different thing. It is a lie that just because you go through menopause that your migraine will go away. That is a dirty lie. People will be like, if you just get a full hysterectomy, all of this problems will be solved. Wrong. Um, so it is usually the change in those hormones. So when it drops the week before, that is when people tend to get an attack. So it's pretty cyclical. You can like do things like pre-treat and think about estrogen detox and all of these things as well. That makes sense.
Yes.
There's a
My
lot.
mind is like actually blown right now.
Migraine is
Um,
crazy.
yeah, this is, yeah, I'm okay. You answered a lot of my questions through that little
Okay, good.
snippet. One question that I have that's still a little bit basic
Mm-hmm.
is what is the difference between migraine and vestibular migraine? And do you
It's the
treat
same.
both? They're the same.
It's the
Okay.
same.
Okay.
So migraine is an umbrella term for all types of migraine disorder.
Okay.
So you can have hemiplegic migraine, ocular migraine, vestibular migraine, painful migraine, migraine with aura, migraine without aura. You can have all these different types of abdominal migraine, right? All
Mhm.
these different types of migraine. It is all exactly the same.
Okay.
However, it's again back to that spectrum. It's a spectrum of symptoms.
So they kind of pick out like, correct me if I'm wrong. So if it's abdominal, like that's their like main pain point, or like if it's vestibular, maybe it's like dizziness or headache. And if it's,
Yeah.
does that make
So
sense?
migraine, yeah, yeah. Migraine is a full body condition. It's a neurological condition, not just a brain neurological condition. Does that make sense?
Mm-hmm.
So
Mm-hmm.
your full body condition, meaning like your vagus nerve, for example, runs all the way through your whole entire body practically, and also impacts your abdominal situation, like your intestines and everything, right? And so it impacts that. Some people will get a racing heart during prodrome. Again, whole body situation. So your gut health will affect this, all of these things, but it's just kind of what you are genetically predisposed to, or not even genetically predisposed to, but just predisposed to. So I know some people who get like vestibular neuritis, which is an inner ear infection, who have a
Mm-hmm.
history of classic painful migraine, who now have vestibular migraine because of that infection in their inner ear. So
Okay.
it's all the exact same disorder. It's
Mm-hmm.
just what part of your body is overstimulated and which part is being affected. And I even know of many patients who, like, the week before their period, they get a painful migraine, but if they get too stressed out, they get a vestibular migraine. And there's zero rhyme or reason to it.
Okay.
But they know for themselves through like tracking and living with this for a long time and treating it different ways and things like that. Because there's a million and one things you could do to treat migraine. I promise you, you are never out of options. And if your neurologist tells you, I have nothing else for you, they're wrong. Maybe they don't have anything else for you. There are 1 million things to do about migraine. So you should know that. But it's just a spectrum of stuff. Like you can have it with head pain, without head pain, with dizziness, without dizziness, like whatever.
Okay. That
Yeah.
makes a lot of sense. I'm going to ask just one more question
Okay.
today, you guys, and then we're definitely going to do a part two because I have hundreds of more questions.
Okay. Go.
Just like a super simple, and I don't even know if this is too elementary to ask
Oh,
or,
please ask.
but
Literally, people don't know.
if you, do you have like three things you always tell people who have migraine? I feel like
Yes.
one of them is kind of like what you just mentioned, like no matter what symptoms you're
Mm-hmm.
experiencing, like there's always something else to try. Do you agree with that?
Always. Yes, 100%. Migraine is treatable. You have to go back to this like bucket situation. We have to talk about nervous system regulation. We need to talk about inflammation. We need to talk about mitochondrial metabolism. We need to talk about supplementation and micronutrients. And like literally, there are 1 million things. There are some basics you can always start with. Making sure you're strength training, making sure you're not doing honestly too much high intensity like cardio slash interval stuff. um Making sure you're doing walks, spending time with people you love, having that like connection with people. Doesn't have to be romantic, it could be a friend or a family member, it could literally be one person, it doesn't matter. There are a lot of like basic things we can do, and then there are more intense things we can do as well. So no matter what, there's stuff you can do. I like to start with supplementation, hydration, electrolytes, and nutrition. Honestly, a lot of people, if not everyone, needs some sort of acute medication or acute treatment. Doesn't necessarily have to be a medication. We can talk about that.
Okay.
But
Yeah.
everyone needs an acute something because untreated migraine gets worse. The more
Okay.
attacks you have, the more attacks you will have in the future.
Cool. Um,
Yeah.
do you have like nutrition, all of those things that you talked about? Is that all in your group fit?
Oh, yeah.
Yeah.
Hmm.
Do you have
Yes,
like
it is all in group.
lower level strength training in there? Like
Oh,
if
yeah.
it's somebody that's
Everything is
never
scalable.
cool.
So the way I have designed vestibular group fit, which is this is honestly, this episode is not supposed to be a plug for this. You can listen to my podcast Grounded if you have more questions about vestibular migraine and migraine. Slash, we will also do a part two on migraine. But Everything in group is scalable in that it like you can do with less weight, you can do fewer rounds, and like we cue that throughout. Slash, there's also like a how to scale exercise video that you have to watch before you, or that we recommend you watch before you start exercising.
Okay.
Because there's a lot of things to consider, from your blood sugar to how long it's been since you've exercised, if ever.
Okay. Yeah. I'm
Yeah.
just asking for a friend. So,
Yes, it's in there.
yeah, yeah. And I
Yes,
know
it's
it's
just
not
in
meant,
there.
but yeah, I was just asking because I
Yeah.
genuinely haven't
Mhm.
explored it. But that's so cool, you guys. Okay. We do have to cut it off for today. We're short on time. We are going to do a part two with
Yes,
more
promise.
questions. Obviously, send any questions that you guys have. Thank you
I'll
so much
answer
for
them.
joining, and
Yeah.
we'll see you later.
See you later. Thanks so much for listening. Bye.
Bye.